morning to all of you. My name is Kalyan Chakravarti. I am 34 years old person, and I have met with an accident in 2013 in March 12th. So it's a major accident, and from last 2 years I am suffering from a bad knee injury. So my condition of my leg is very badly damaged, skin and knee. I was gone for many more doctors in Andhra and Tamil Nadu, Chennai. So many doctors I have met with, corporate hospitals, corporate doctors, but they doesn't give any hope for me for my leg and all. And after that, for a last long search of my doctors, I was searched one doctor in Chennai, Dr.A.K.Venkatachalam. I have met doctor in Meenakshi Hospital. He is working in Chennai Meenakshi Hospital, and I met with him, and sir has given hope for me to my life, but it will take some time due to the heavy loss of my skin and position of my knee. It's very bad. So after so survey, the surgeon study of my knee, he came to do this thing, and he struggled a lot to bring back my position back. And recently I met with surgery. I have done knee surgery. It's gone very well. Happily, my position is got back up to 120 degrees, bending comfortably, and there is no any pain and no other problems in my knee. Skin also came down to settle down. The skin, this is the area was accident part of my knee was damaged completely. The skin also, that surgery was done, and it's also settled down properly. And implant was there. The implant which is given, it's oxynium knee. After so much study on my knee, he is for young. I am due to the young, around 34 years old. So a normal implant is around only for 15 years it will come, because the implant will be given for old persons who was the cartilage and all, it was completely like it's damaged, like something, it's gone. For old persons they will give the implant. For me, in my conditions, the implant, if I wear a 15 years normal implant, it will be very problematic for me, because I can't go for a resurgery every 15 years. So doctor suggest me, and after study of my knee, he given for a oxynium knee, oxynium implant here. He brought from, and when wearing that implant, some bone loss also is there, like 3 inch of bone loss is there in my knee of bone. So the implant was not suitable that time. Again he studied for this thing, so he thought to put some bone and all, and he opened this surgery and he studied. He taken a 3-dimension of angle of my knee, and he decided to, we can no problem, we can give the implant in that. So it long lasting, it will come around 35 years of my life, the implant will come. So after so much study, so much struggle of doctor, he given this implant in my knee. Now my condition before 1.5 years back, I am totally depressed, because I met several doctors in Chennai, Hyderabad, like in Visakhapatnam. I doesn't have any hope. So many doctors has told me only thing that we need to remove the leg, or we used to fuse the leg. So I have no hope about my future, because if ampute the leg means nothing else to do. So my rest of life, what we do, what I can do. I was so much depressed and so much worried of my life. So when I was met with Dr. Venkatachalam, he has given a very big hope for me. I am now walking. I am walking now. I am sitting on chair comfortably. I am bending my knee comfortably, and I am climbing stairs. I am doing cycling. Everything. I am doing the normal activities. So whatever activities I am doing comfortably. I am very, very happy. His life was came back. You search for a doctor, a right doctor. That was Dr. Venkatachalam. Although in ortho and all, he is treating and all as a very nicely and very friendly, comfortably. He is not treating like not a patient. He is treating like like his own relative. And if you go for a doctor, if you treat like a patient, we can't. The patient also, something will depress. If you give a hope, every session we used to meet with the doctor, he will smiley face and he is to give some hope. Nothing will happen. He is to give some moral support. That we need to. That should be there from the doctors. That I find from Dr. Venkatachalam. I am very happy.